So again, welcome to this webinar, Healthcare's Digital Frontier and QA's Vital Role. In today's presentation, we'll take a look at healthcare today and why consumers are key. And of course, that's it seems like a pretty obvious statement, but what then we do from a technology standpoint to make sure that we're meeting the needs of our consumers. We'll also take a look at some of the rapid evolution we've seen here in 2020, particularly as it pertains to COVID, and then specific trends in quality engineering for healthcare. And we'll also have a Q&A section at the end. So today's panel, I'm going to turn it over to our panelists to introduce themselves. Kate, we'll start with you.
All right. Thank you for letting me be here. My career has been long and had an emphasis in project management, program management, and a heavy emphasis in quality management. Even though I work in healthcare now, where we are has made me reflect back on my experience working in finance, working in retail, and applying a lot of those things to where we're going in healthcare. So I'm really looking forward to learning from the others on the panel and from people attending. I think it'll be super fun.
Hello and good afternoon. It's Michelle Clark, Principal Consultant working for TapQA. I've been in the IT industry for a long time, 20 plus years, with a focus on the quality practice, and I've supported many verticals, both in retail, telecommunications, healthcare, and as a consultant, supporting a lot of clients in their transition or transformation from quality assurance to quality engineering. I'm looking forward to the discussion with you and to learn how we can support you in that journey. And I'll pass it to Michael Felice.
Hey everyone, this is Michael Felice. I am the Senior Director of Digital Marketing with BC Forward, and excited to be a part of this. I, along with Michelle, have been working in the consulting services industry for about 25 years, and excited to talk a little bit about healthcare and some of the trends, the impacts, and what we see coming up next for healthcare. Sam?
Yeah, my name is Sam Bremseth-Vining. I have been with TapQA, now BC Forward, for about 2 years, and before that I worked for Epic, the EHR vendor.
Great, thanks everybody. And I'll do a quick intro as well. I'm Kirk Walton. I am the Director of Client Solutions for BC Forward. And again, for those that are familiar with TapQA, maybe not as familiar with BC Forward, but we were acquired earlier in the month, and very excited about our joint venture moving forward as part of the BC Forward family. We'll certainly talk a little bit more about BC Forward at the end of the presentation. But just wanted to alleviate any maybe confusion that you had, but very excited for TapQA and BC Forward to join forces moving forward. So healthcare in 2020, I don't need to tell you, of course, that the world of healthcare is complex. Every industry has unique challenges, and healthcare's complexities provide some really difficult challenges, particularly as it comes to technology. There's an increasing need for healthcare companies to operate like software companies, even though software is not necessarily the mission, or in some cases far from the mission of healthcare organizations. In 2020, you have to really operate like a software company, and you need to have a digital presence and a functioning IT infrastructure to be successful. And no matter where you align in healthcare, your mission is to serve your audience, whether it's your members, those providing the services, those supporting the organization. All these groups operate so differently, and a payer is different than a provider, and that's different than a startup healthcare tech company, and it's different than a compliance team within a global healthcare enterprise. And there's just so many audiences that we in technology have to account for. And those audiences, particularly consumers, they all have high expectations. In the Amazonized world that we live in today, patients and members expect a seamless, informative, and intuitive consumer experience in today's healthcare world. So I wanted to stay on that first point there. And Sam, I know you wrote a blog recently really highlighting the consumer expectations in healthcare. So I know you have some specific thoughts on this.
Yeah, absolutely, Kirk. So I think, and I'll kind of distill the blog down here. So at the end of the day, it boils down to the fact that a majority of consumers, and this is not just those who are especially tech savvy, right, spending all day on Instagram, waiting in line for 24 hours for the new iPhone, but just your average consumer, now has access to and uses a variety of digital applications and tools every day that generally work very well. And this digital tech has become so integrated into everyday life that we don't even really realize it's there anymore. I mean, if we just sort of think through a day in the life, let's say it's payday. I can hop on my bank's app on my smartphone. I can check my balance. I can schedule some payments. I can make a transfer to savings. I want to go out to eat that night. I can compare the options on Yelp. I can see reviews. I can see ratings. I can make a reservation. Maybe I just want to order a pizza instead. Well, I can also do that through an app or online. I can track my pizza's progress from prep to the oven. I might even be able to see who's making it. I know what time approximately it's going to be done. Maybe I have a vacation coming up, right? Well, I can choose from a number of sites or applications that are going to allow me to construct my perfect trip. I can set up my rental car, set up my hotel, set up my flights all in one place. And we use digital tools for everything now, and that's just a small sampling, so often without even realizing it, and we take it for granted. The end result of that is that the consumer expectations around the quality, availability, and security of those digital solutions and tools for every industry is going to be pushed forward and continue to rise.
Right, and I know healthcare is an industry that, obviously has made many advances over the last 10 to 20 years or so, but still, I think the thinking is that they, maybe trail a little bit when it comes to the consumer experience.
Can I give an example of an exceptionally confusing consumer experience in healthcare?
Yes, Kate, yes, thank you.
And it's just such opposite end of the spectrum to the examples that Sam was giving. So my husband is using eye drops, and every month he gets a kind of a different prescription. They're trying different things. So the co-pays have been running, $3.50. Suddenly last month, his new eye drops were $33 after copay. That's a kind of a small thing. It's, 10 times more expensive example, but no one could explain it. Not the website, not the pharmacist, not the packaging, not the EOB. So my comparison would be me walking into Cub and my toothpaste suddenly costs $40 a tube, but it's the one my doctor wants me to, or my dentist wants me to use.
Right.
So I believe that this example you have on the screen of the EOB or the claims being accurate is an endemic problem in healthcare.
And it affects multiple audiences, as we talked.
Absolutely. We all want to solve it.
One article that Michelle, you and I chatted about recently was something that you shared with me. It came out of Harvard, and I know that you just included this in your blog that we posted on tapqa.com yesterday, and that was about customer centricity in healthcare. And the author talked about the 5 E's. And the 5 E's simply were experience, the experience that a medical professional has that will lead to a cure, the empathy to make the audience and the patients feel that the provider cares, and the efficiency so that the audience won't be kept waiting, economy to make sure they're getting fair value. And Kate, you actually just kind of touched on that a little bit. And then the empowerment that gives all of us a degree of choice around our treatment plans. And I think all of us in technology can clearly see there's a path for us to be able to make vast improvements in all 5 of these E's as we're improving the consumer healthcare experience. And quality engineering, of course, is so critical to ensure that that technology works. So with the focus then, here's a link to the article as well, and we'll again have this in the slide deck for everybody after the presentation. But Michelle, I know your background, a lot of background in healthcare, but a real significant background in retail as well when it comes to quality engineering. So I guess the question is, can we just make healthcare more like retail?
Oh, great question, Kirk. People expect convenience, quality, and transparency when they're choosing how to spend time and money. And increasingly, they are seeking the same from their healthcare providers. Retail health is emerging as a means of delivering quality, convenient care to millions of consumers, as well as a model for healthcare systems to consider when providing services to new and existing patient populations. Healthcare providers are gleaning insights from analyzing how retailers craft an in-store and online experience to engage their shoppers and their brands. So increasingly, the experience that the healthcare providers create for the patients, from online information to the design of an in-person engagement, can have significant positive impact on the ability for them to attract and cultivate client relationships. As in retail, a store was once the primary location for people to buy or sell goods and services. Today, it is only one stage in the shopping spectrum. Faced with competition from online shopping outlets and television shopping networks, retail outlets have had to adapt to survive. And today, the store plays a different role for brands. It creates the customer experience. Retailers know that localization, community, education, hospitality, convenience, and in-store tech are all critical components of connecting people what they hope to attract. And the storefront location should be leveraged more to spur sales. Healthcare can learn valuable lessons from retail's example. And engaging people means connecting with them where they live. And that's a place away from the hospitals or outside the acute care setting.
Great, thanks, Michelle. Obviously, it's one thing to say, hey, can we make this more like retail? But of course, it's not that easy. It's not as simple as flipping a switch and saying, okay, be like retail. And Kate, I know that you see a number of quality challenges that we face in healthcare that complicate things.
I do. And one of those is that the core systems for most healthcare organizations land around supporting members, paying claims, managing patient records, and scheduling. And we call those legacy systems, and some of them are aging, but they are the bread and butter and extremely critical to our business. So what we're doing is we're finding ways to reskin and replatform those to keep up with the digital transformation, while keeping availability, compliance, HIPAA, and extreme attention around member privacy all in mind. What I wanted to do is kind of dwell on the fact that we need to do this in a caring and personalized way around data that's just hard data that needs to be maintained. So that last shopping cart on the screen is, I think, the opposite end of that spectrum, managing data that's critical and held generally in old systems, and providing it to a consumer in a way that makes them feel cared for and provides them the experience that's efficient and compliant. I know that our organization is engaged in large replatforming efforts, and I would guess that other healthcare organizations are engaged in the same.
Right. Oh, thanks, Kate. That's a great perspective. When we're creating technology for our consumers, one thing we need to keep in mind, of course, is the multiple audiences that we've mentioned a couple of times now, and that healthcare organizations just can't adopt a one-size-fits-all approach for all the different audiences that may access the technology. And Mike, I know you've worked with a handful of healthcare organizations in your career, and you've seen how an audience-centric approach can really make a difference in the end product.
Yeah, I think this is a fun thing that most organizations, as we continue to see how software, the evolution in software development, one of the things that we are starting to see is certainly putting more of a focus on design and how quality can actually impact design. So I think there's a lot of emphasis that we've been putting, I think, regardless of whether it's healthcare or other industries, into the idea that we kind of have a focus on design thinking and really putting the end consumer in mind. And this has led to, understanding more personas and really understanding some of that. And I think where this starts to play a part in a very interesting way is in the healthcare space. we've seen certainly technology, as Sam was mentioning, we've certainly seen technology start to enter in and continue to be a bigger part of the technology or the healthcare space. So whether that's in telehealth or other areas, that's certainly become more and more dominant, or technology has become more and more dominant in terms of what people's expectations are. However, sometimes we can overcomplicate or sort of over technology a solution within the healthcare space. And I think a classic example of that has been in terms of the idea that some end users are going to leverage and use chat functionality. And so with one of our consumers and healthcare clients, they had put a huge emphasis on understanding and really implementing a chat functionality for a group of end consumers that was mostly Medicare and Medicaid enrollees. And because of that, they simply just weren't using the chat functionality. So as they went through further iterations of really understanding their population and who was using it and what was really going to be most leveraged by their population of members, they understood that, you know what, maybe some of these technology things are a little ahead of the curve of where our member population is at. And so that was just a key contributor to, you know, how both, I think, payers and providers are really trying to better understand their audience as their audience with the amount of data we're all wanting to request continues to exceed or continues to excel.
No, absolutely. And I'm glad you brought up design thinking and, you know, testing in the lens of personas. We're going to dive into that quite a bit more later on, because that's such a big trend in quality engineering that we've seen with our clients and that we've helped implement with our clients that certainly applies here to healthcare. And you brought up a great example of that. So we'll dive into that a little bit further later on as well. So thanks, Mike. And again, here in 2020, due to the pandemic that we're all in right now, caused by COVID-19, we've seen quite an evolution in healthcare technology as well. Patients and consumers, we've all had to adapt. We've had to adapt a great deal, and particularly those who aren't comfortable with in-person visits right now. And many of us aren't. Many of us want to try to stay away from doctors' offices as much as possible with fear of potentially catching the virus. So how healthcare organizations have provided service to their patients, that's changed a great deal as well. Kate, I'd like to turn to you again here, because you work at Health Partners. And for those not familiar with Health Partners, those that are maybe outside of Minnesota, absolutely fantastic organization, but one that sits on both the payer and the provider side. So you've seen firsthand many of the changes that COVID has caused.
Yeah, so this picture really kind of depicts our world from a member's perspective. So our members go to clinics, our members go to hospitals, our members use websites and get information on paper from us, and our members work with real people that they might call into in our member services or customer care areas. And you can see our first little COVID guy up there. These describe some of the changes that we had to make very quickly, and each one involved technology. So supporting searches that would allow us to send letters and do communication around forced cancellations, update our websites to keep our members up to date on changes to hospital hours and rules. Certainly providers are one of our audiences, and they needed up-to-the-minute information about tools to protect themselves, where they might be working that day. Moving to our clinics, kind of what Kirk was saying, mass numbers of visits were just canceled, either temporarily or converted to telehealth. We also needed to support those who needed to continue to visit our clinics. So again, targeted communication with technology to support it for sectors of our member community that still needed to have an in-person visit. As for our websites, we needed to support through content, and definitely used our quality engineering practices here to provide numerous changes on a daily basis. We had peak times during the COVID crisis, which we're still in, where information was changing hourly. And I am so pleased to say that that was handled extremely well by our organization. And finally, for those who supported our customers and members over the phone, call volume, as you might imagine, went sky high, and new scripts, new tools, new queries were written to support the people supporting our consumers and members over the phone. It's an ongoing situation that I think is going to have peaks and valleys, and quality engineering for us has played a huge role in having this be as painless as possible for our members and providers.
Great. Kind of leads us to our next slide. I mean, and this is true of really every industry, of course, and as technology has grown and continues to grow and will continue to grow, quality matters more than ever. But and for those that have maybe seen our past presentations on quality engineering, you might recognize this slide. But it's true, quality matters more than ever. I mean, and that is not going to change. And as we've seen, the healthcare industry relies on software more than ever before. And consumers demand that Amazonized experience with everything these days. So all industries need to keep that in mind, but healthcare does as well. And with the growth of so much new technology and so many platforms, again, quality, it really does matter more than ever. I mean, there's just exponentially more things that you need to account for and more things that can go wrong. So quality organizations within healthcare really have more importance than ever before. And hopefully those of you on the call have certainly seen that as well, and just how quality is being emphasized within your organizations. So we've seen that healthcare organizations have adopted quality engineering principles. They've greatly improved the delivery of successful products to their intended audience. And again, with technology advancing so much over the past 20 years, enabling testing to be performed much quicker across multiple platforms and ensuring software can be released to its audience much quicker, those are all critical things. And accelerated software delivery and improved predictability in technology, it allows for deeper analysis by the creation of a greater wealth of test data. So I want to turn it over again to Michelle. You are a quality engineering expert. You've been doing this for a very long time. How do you best describe quality engineering for those that aren't living in the quality world every day? And then what does it mean specifically for healthcare?
Yes, thank you, Kirk. Digital transformation is going to demand new approaches to the testing practice. And it's going to require a shift in priorities to include strategies driven by DevOps and Agile. And it's the need to connect new technologies to existing enterprise and legacy systems. Kate mentioned that earlier. Tighter integration between your development and your testing activities, and the demand for faster test cycles that's going to need to incorporate user feedback into the development and testing process. Hospitals and health systems need a strategy to re-engineer their own digital transformation, making healthcare more manageable, accessible, and simple to use. And we're seeing a shift towards value-based health through better outcomes and quality for patients, as well as service providers, and reduced costs. In the end, the patient's going to be far more connected to the physicians, and technology is driving towards this.
In general, I wanted to share this once again, and this is something we talked about on our prior webinar of quality engineering, but it's really the journey that an organization can go through from quality assurance to quality engineering, and just the transformation in maturity. And this is a chart that we use with our clients to identify their maturity level. And many organizations created their quality organizations around the idea of quality control. You see on the far left, really the focus more on manual testing, finding defects, checking the boxes, making sure that something is functional, but again, lack of metrics, very minimal use of automation or tools. But organizations, of course, have progressed through that journey, and many are on the other end of the spectrum right now. Michelle, you helped put this chart together. Could you walk us through this a little bit more?
Yeah, absolutely. So, and I think the important thing to understand, especially if you've attended previous session when we talked about this slide, it's, it doesn't matter where you are. That's okay. But it is important to establish an understanding of where you're at from a maturity perspective, and set some goals for where you want to be. Within quality control, it's a reactive approach. You're doing some manual functional testing. You may have some processes defined across your enterprise. There may be no or limited test automation, maybe not a real good insight into what percentage of that automation is really accounts for your test suite or your test coverage. You may be using some tools to support your efforts, but you might have a lack of metrics, not an ability to consistently measure the quality of the progress that you're making. So as you transition to quality assurance, that is considered a proactive approach. You've incorporated more testing within your practice to include non-functional testing. You do have your processes defined. You have a strategy around test automation. You streamlined your environments, and you actually do have traceability to your features and functionality. You have some insight and understanding about your coverage. As you move on up into quality engineering, we like to describe that as a shift left driven approach. You have a targeted expectation around your test automation and your test data. You're using extensive tools to support your testing practice. You'll have a strategy around performance engineering. You're taking a close look at your production incidents, and you're doing root cause analysis around that. You're analyzing your defects and looking at opportunities to instill quality sooner in the life cycle. And you've probably invested in technical testers within your team to support that targeted test automation and data. As you transition into integrated quality engineering, we like to call that the DevOps driven approach. It's continuous testing, and you within continuous integration and continuous delivery. You're considering shift left principles, testing earlier in the life cycle, as well as shifting right and evaluating some of your decisions within production. You know, you're considering lifecycle automation. You actually have a focus on your user experience. And in a lot of teams within integrated quality engineering, they've embedded software development engineers and tests to support their efforts. And at the very top, we have advanced quality engineering. We're looking at, you know, AI and machine learning for test optimization and also predictive quality. So this infographic was created to help in conversations within an organization to establish an understanding of where you may be. Of course, within all what we've described underneath them, there's many dimensions of those areas to speak to. But again, it's a great way to have a conversation with your peers within your organization, to establish where you are and to make some decisions about how you want to journey, what your journey needs to look like, and make some targeted investments to support that.
Great. I'm just curious, you know, with the audience today, you know, where you feel that you fall on this on this scale. So I will have a poll here. I'll share with everybody. But yeah, where do you feel that your organization falls on the QA/QE path for those that are joining us today? I'll give folks a little bit of time.
Darn, this is Kate. I wanted to answer that poll so badly, but
go ahead and answer. You can answer it right now.
I really have reflected a lot on this slide because Health Partners is definitely on this journey, and really just in the last couple of years have started regularly using the phrase quality engineering. And I think it's made us think more broadly when we talk about quality, and it's less about does the software work or not work, and it's more about how we approach the work that we're doing.
So where you would say you are in the quality?
Well, I would love to say that's where we are. How about that for an answer?
Okay, perfect. It sounds great. So we have 12 answers here. You know, and not surprisingly, you know, I'd say the majority of the folks here, you know, align with quality control or quality assurance. And that is absolutely what we expect. And when we've run these polls and when we've talked to organizations, you know, I would say a larger percentage are, you know, on the left side of this scale than on the right side. It's interesting to see two folks work for organizations that are already practicing integrated quality engineering and some more advanced steps. So that's great. For those that are doing quality engineering or integrated QE, feel free to share in the chat room, if you would, just some of the, you know, some of the success stories maybe that you've had, and we'll share those during the course of our presentation here as well. So again, here are the results of that poll and where everyone aligns. So great. No, it's again, something that we do quite a bit with TapQA and BC Forward is help organizations to take that next step in their journey and certainly reap the advantages of moving down this path. So I am going to move along to the next slide. And this is just, you know, these are some of the examples of where quality engineering really comes into play. And one thing, again, we need to keep in mind is that audiences are going to be using our products from multiple devices. Not all Apple devices, as you see pictured here, of course, but certainly from all kinds of devices. So this creates a challenge that so many legacy systems were designed maybe with one platform in mind, or at least older platforms in mind. And as those products are migrated to cross-platform technologies, the testing efforts that come out of that are going to be huge. Kate, I know that you have some examples here as well.
Well, this is just, it's an example that I find just interesting, that it wasn't too long ago that our organization didn't support Macs. And now this slide that you're using today has all Mac devices, or all Apple devices. And when I say not too long ago, it's been years, but when you think about how quickly the technology world is changing and customer expectations just keep moving right along with that technology.
And Sam, I know you come from the EMR world, as you mentioned, from you know, from your past before TapQA, and I know there's you know, there was a need to test on just, you know, multiple platforms there as well, and that's something we're going to see more and more of.
Yeah, and I think, and Kate touched on this briefly here, but I think it comes back to the consumer expectations and the fact that today cross-platform content is everywhere, and it's only getting better, right? There was a day, and this is kind of going back to what Kate was saying too, when a lot of things were only accessible from your PC. But today, websites work on your phone, or there's an app, or there's both. And with so many platform options, whether it, you know, is PCs, tablets, phones, how many different makes and models you can choose, people have come to expect, because the content is out there, that they're going to be able to access their digital solutions and tools with their choice of technology. So, and with technology everywhere too, organizations may have multiple platform demands internally, right? To give an example, we might have the nurses on iPads, you know, the doctors are using their laptops, but maybe they also use their phones for certain workflows. And I think at the end of the day, you need to be certain that your hardware solutions and your software align to allow your users to complete their intended workflows.
Right. Well, and again, with more platforms, I mean, more things can go wrong. As we mentioned, I mean, you don't want to have a well-oiled machine on one platform and then have an incredibly buggy experience on something else. You really want to have that seamless experience for our users across all platforms. I mean, if you're making an appointment, you should be able to make an appointment the same way on a PC, on a phone, on a tablet, regardless of you're doing Android or you're doing iOS. I mean, everything should really be seamless and the same if possible. And you know, that's a great use case for what we call Humanual testing. And it's something that, again, it's another piece of quality engineering that we've really been emphasizing with our clients and have seen some great success stories in the sense of just, you know, again, with quality engineering and test automation, I mean, we're able to free up so much more time with our QA professionals to really focus on the things that are important. And we see end user satisfaction as being probably the most important thing a quality organization can do. I know, Michelle, this is something that we've really emphasized with a number of our clients and folks that you've talked to.
Yeah, absolutely. This Humanual testing, I mean, it's definitely something that has to be focused in within quality organizations. It's you know, in the past, we may have reserved some of that expertise or that responsibility with our users, our business users, or maybe people that are focused from a different aspect within an organization. But within quality engineering, the quality professionals are going to need to engage more and have that understanding to support that and ensure that those personas are created and there's a strong understanding about that business process to ensure that we're engaged in practices to ensure that the customer is happy about what we deliver them.
Well, absolutely. Well, one example, and I know we had a question before about, what is persona and what does it look like? We did put an example here. And this is something that it's similar, not the same, but similar to something that we used for a client that was creating applications for event sites. And what we did for every site that we were testing, we had 4 to 6 different personas, different priorities and passions represented, to really try to get in the shoes of the folks that were more commonly going to use this application. I know Mike brought up an example before of, again, the chat room that this organization, or a chat functionality with an app that this organization put together, using the persona of maybe someone like Hubert here, that we would say, Hubert is relatively comfortable with technology, but maybe not comfortable enough to be constantly using that chat functionality. That's something that we really emphasize with Humanual Testing, in that we want to make sure that the end user experience is going to be a very positive one, regardless of audience. So again, with healthcare applications, creating a wide array of personas as your potential customer base to align with those different audiences, we see that as a great idea, and something that we, again, have had a lot of success with our clients in implementing. And again, Humanual Testing is really just, it's a term that we made up, I guess, but something that is really deeply rooted in design thinking. And for those that are maybe unfamiliar with design thinking, TapQA, we do have training around that. BC Forward also has training around that. So our joint venture moving forward will have a lot of coursework around design thinking for those that may be interested in bringing that into your organization. Be happy to talk more about that. Data privacy, again, this is one of the bigger issues with healthcare. Sam, again, you wrote a blog recently on ensuring quality in healthcare data. So what are some of the things that quality organizations can do to contribute to data privacy and security efforts?
Yeah, so I think it just pays to state here that data privacy in healthcare is paramount. It's both a consumer expectation and often a regulation. And this is going to apply both to your consumer-focused applications, your patient portals, telehealth services, smart device integration, etc., where there's going to be both an expectation of data accessibility on the part of the consumer and also the continued security of that data. However, there's also the internal systems and processes that have to be kept in mind as well. And you want to ask questions such as where are we exposing PHI or customer data? Is it secure? Is it appropriate? Is it necessary? Are the test environments de-identified? Are the correct test environments de-identified? Can we de-identify and still continue on with what we need to do in this area? And I think it all comes down at the end of the day to managing risk while fulfilling that consumer expectation around the confidential info and while maintaining regulatory compliance. And this is going to continue to be a challenge in the future because the opportunities and demands for access to healthcare data are only going to continue to rise, whether that's within an organization or on the part of a consumer. However, along with that, the risk of unintended exposure or misconduct is going to rise. And the only thing that's going to stay the same there is that continued expectation of privacy and security.
Mm-hmm. Right. And again, data de-identification is such a critical topic these days as well, with test data management and just the things that we can do to make sure that we are creating an appropriate level of test data and not using production data like you mentioned. So
correct. Yeah.
I'd like to echo that I agree with everything Sam just said, and want to add that the creative tension there is that we need to build and maintain software solutions really quickly and satisfy all of those privacy concerns. And there's a lot of tension between those two goals.
Exactly. No, thanks, Kate, and thanks, Sam. One last point, and then we'll be opening it up for a Q&A after that, and that is accessibility testing. And that is a critical piece of quality engineering for the healthcare world. It's so important, particularly in healthcare, and particularly with the wide audiences that we serve. And Mike, I know we've done quite a bit of work on with accessibility testing with a number of clients, not just in healthcare, but also in healthcare as well. And some points that you have on accessibility testing.
Yeah, I think this is definitely an area that continues to be kind of a growing field, and I think as we continue to try to address some of the technology curve, part of this then also needs to be compliant and accessible for everyone that is either sight impaired, hearing impaired, and so that's just led to frankly almost another sub industry within the quality assurance industry of accessibility testing. And I think we saw some of the impacts of this that really started with retailers about 15 to 20 years ago, with more just better understanding compliance and how they could really have a storefront in a virtual setting. But now that we have continued to go to everything virtual, accessibility testing is becoming a larger and larger part of all testing formats across a lot of different places. And that certainly is what we're certainly seeing is looking at things like screen reader technology and making sure that we've got an area and a time and a format to make sure that what we are putting out there is has that accessibility for all the audiences that we are looking to serve. So this has been a fun shift to see this continue to be more at the forefront, and we continue to see organizations that have those needs, which has been great to see people take this seriously and get it as a part of their normal cycle.
Yeah, it's very encouraging. And we've had, even at TAP QA and BC Forward, consultants who have really found their calling doing accessibility testing, and really just it becomes a real passion to give back to those communities and everything. So it's been an exciting venture for us as well, I would say. So no, great points on accessibility testing. So with that, we will open it up for Q&A for those that are on the call. I mean, please feel free to enter questions, whether they're in the chat room or in the specific Q&A section. And before we open it up for Q&A, again, here's our contact info. Very much would love to continue the conversation. You see our two websites, both TAP QA and our parent company, BC Forward. And then you have my email address as well, kwalton@tapqa. We have exciting practices around telemedicine and interaction virtualization, EMR process analysis and workflow development, claims processing and fraud detection, claims systems development and implementation. Really just kind of run the gamut when it comes to our healthcare service practices, both from a strategic standpoint, from a software development standpoint, of course, from a testing standpoint. So really, again, run the gamut for so many different service offerings that we can bring to you and your healthcare organization. So we'd love to talk further. Again, you can reach out to us at my email or check us out on our two websites. So with that, let's open it up for Q&A. And we do have one question already, and I'll start with that, and then we'll hopefully get a few more in. And please feel free again to enter those into the chat room or the Q&A box. But Kurt asks, Agile purists would say quality is the responsibility of all. And this can lead to the belief that there is not a need for a tester or an SDET because just everybody needs to be responsible for quality. So having someone specialized isn't necessary. So what is, I'll ask everyone on the panel, what's your thought or the reaction to that belief?
Well, I'm happy to jump in and answer that question since nobody else is wanting to take that one on. As somebody that's attended national conferences for probably the last 5 to 8 years, certainly in terms of kind of organizations moving toward doing agile transformations and really better understanding, hey, I really would like to move towards this. I think that we find there is this idea that, hey, everybody should have quality as part of their responsibility. So does it really need to necessarily be a role? I think the answer is that, those same rules and things could be applied to things like project management and other areas where it's like, well, if everybody has a project plan and we all know what we're needing to do we really need to have that role? And you start to better understand that in the world of Agile, and I think if we try to, go, really look at that manifesto, the problem that or the challenge that we see most often with organizations is that it's really hard to be Agile purists or to really go towards the manifesto because of one singular reason, and that singular reason is people. And generally speaking, processes work great until you start adding people. And it's not that people are bad or inherently don't know what they're doing. It's just that there gets to be shifting priorities. And there gets to be different things that organizations do that may shift those priorities. And based on that, that's when we can start to see things like quality either slip or have a different perception of it. And so that's where you really start to see the idea that not only do we want to make sure that we have the right perception of quality, but we also have really the ability to make sure that we have a way to report, a role that is really focused on the idea that what we intended to do is what we actually did. And that really is where, I think quality can help play the role and continues to play the role, not only in validating those things and understanding risk within an organization, but also now being more upfront and really helping with design and because quality is such an integral part of the lifeblood of an organization that now that's where we're actually now seeing a lot of design efforts being done as well. So 50,000 foot view from a lot of different clientele, and certainly from a lot of the conferences that we've seen, I think that there is this idea that quality needs to be done by everyone, but there is just the practicality of everyday life and software development that tells us that we can't just be a pure methodology or have a pure methodology work other than maybe in really small organizations. Kate, Sam, Michelle, any other thoughts on that?
Yeah, Mike, you touched on a couple of key critical things. And yes, it's true in that Agile manifesto, it's qualities, everyone's responsible for quality, and that is true. But we also know in our broad testing experience that not everyone has a quality mindset, and the ability to be able to identify and capture an understanding of the testing practice and how we can take some objectives and create, the testing objectives around that and layer in the risk and provide those metrics to help people recognize where you are from a product quality perspective and a progress perspective. So it is, in our perspective, and I am passionate about testing. I've been a developer in the past. Testing has been my focus for 20 plus years. And there is definitely a differentiator in an organization that emphasizes and focuses on that role.
I'd like to add that the experience on my own team is that we are moving more towards an engineer is an engineer, and we're trying to build quality acceptance criteria into the stories that we write. We are an Agile team. And it's really been embraced by our team. And I don't know that translates into, the whole industry changed because one team did. But I think that the mindset of our team is now, not only is quality everyone's job, but I do my part in addition to the tester having kind of this siloed role. So I'd love to talk more about this. In fact, it'd be a really neat webinar just to talk about what does an engineer do on an Agile team.
I think that sounds great. That sounds like a good topic for us to tackle here in the upcoming weeks and months to come, for sure. Sam, I don't know if you had any other points from that standpoint.
No, absolutely. I think Michelle and Mike pretty much covered it from my side. I would just say it really helps to have someone who is a consistent advocate for both the consumer and the quality, because it is very well and good to say that quality is everyone's job. And I think that certainly should be true. But I think that does get difficult when things get busy, when timelines get tight, right? Because we all have sort of our area we focus on. So it always helps to have someone who's going to step in there and make sure that at the end of the day, the product or the implementation that's being put forward actually does get the job done.
Exactly. And you know, I mean, we see it time and time again where engineers, many of them are just outstanding when it comes to quality, and they have that mindset, but there certainly are some that just aren't. And you don't want to leave such an important facet of developing software, which is quality, in the hands of folks that maybe you have a whole team that's a weak spot for them or a blind spot. So having that specialty is still just very, very critical. Regardless of agile or whatever team you have. I wanted to share one of the comments that, in full disclosure, this is one of our clients as well. But you know, when it comes to quality engineering, and someone who assessed themselves as being between quality engineering and integrated quality engineering on our scale. But it's been quite a journey so far, as it has been a big cultural change, and we need to get buy-in from our leaders and figure out the budget challenges to support it. They started with quality guilds and quality advisory group, and they made a step-by-step approach to make these shifts. They also engaged with TapQA, again, full disclosure, but got an assessment to learn where they are in the journey and then how they are progressing, which has helped them make a case to their leaders that they're going in the right direction. So the goals of that organization are CI/CD and shifting automation and more focus on prevention of defects than detection. And it's driving them to move forward in the right direction. So great points. And again, that can be applied really to any industry, but you can see after our conversation today, just why it's so critical for healthcare in particular. And just, again, all the audiences that we serve, and just our goal and drive to make the industry and the technology that we produce something that's going to really resonate with our customers and just really make healthcare a more customer-centric industry. So, thank you very much. We did get one question, and that is, will we get copies of the slide deck? And yes, so we'll be able to send copies of the slide deck along with the video recording of this conversation. So with that, we'll open it to maybe just another question or two. But I also wanted to just ask any of the panelists, and again, thank you all for joining us today, but any last second thoughts about the topic of just the criticality of quality assurance and quality engineering in healthcare?
Yeah, I guess, Kirk, this is Sam. I would just say that it just pays to remember in this area that the mission of the healthcare industry is important. So the product that people use to accomplish that mission has to be of the highest quality.
Right. Any other thoughts? With that, definitely, again, wanted to thank everyone for attending. Thank you, Kate, Michelle, Sam, and Mike for being a part of our panel today. And I'll put up our contact info. Just one more time. Oh, no, never mind. I'll just end the slideshow. But again, if you have any questions, feel free to reach out to us at tapqa.com or bcforward.com. And very much, again, appreciate you all attending our session today. Thank you once again. And we will have this recording sent out to you soon.
Thank you.
Thank you.
Thank you.